Hey, thanks everybody for joining us today for Georgia Memory Net Insights. We have a great friend and colleague presenting today, Dr. Kevin Hendler. He works both in the Division of Geriatrics and Gerontology as well as the Department of ENT. And always great to see you, Kevin, and thanks so much for presenting today. I'll go ahead and turn it over to you, and I'll monitor the chat just in case people put some information there that they want you to talk about. So
Okay.
go ahead, Kevin. Thanks again.
Sounds good. All right. Well, good afternoon, everybody, and thanks for inviting me. Hold on, what's going on? All right, we'll just go through all this. I have no financial disclosures to report for this presentation. I just like speaking about dentistry. Okay, here are the objectives. Understand what oral health is, since we're going to be talking about it, why it's important, recognize the relationship between oral health and dementia, and then know how to prevent oral diseases, and hopefully along the way that will improve quality of life. So first of all, what is oral health? And there are several definitions, and I like these couple. This is from the World Dental Federation, and you'll see it's more than just teeth. So oral health is multifaceted. It includes the ability to speak, smile, taste, smell, touch, chew, swallow, convey a range of emotions through facial expressions with confidence, without pain, discomfort, and disease of the craniofacial complex. I like this statement too from 2005. Oral health is a human right, an integral part of general health and essential for overall well-being and quality of life. And hopefully by the end of this, you'll all agree with that. This is from the World Health Organization, and they say one crucial and often neglected area of healthy aging is oral health. Poor oral health can have a profound bearing on general health and well-being through its influence on nutrition, also the experience of pain, problems with eating, chewing, smiling, communicating, and you could see how they're sort of connected. And it's more than just teeth. It's really social interactions as part of having a healthy mouth. So, all right, that's oral health. What about oral disease? Well, there's a couple of kinds. One is periodontal disease, or known as gum disease. And there, it's an infection caused by bacteria, which ultimately results in you losing the alveolar bones supporting your teeth. The teeth get loose and fall out. There's dental caries, or dental decay, and that's another infection caused by different bacteria, which lead to the breakdown of teeth, where they can eventually just break down and need to be extracted. And then both of these can result in an abscess. And actually, I just finished treating a periodontal abscess before this. But and that's an infection where there's pain, there's swelling, and sometimes those can be life-threatening. The National Institute, well, back in 2000, the Surgeon General had its first report on oral health in America. And the big conclusion from that report was that oral health is essential for general health. They also said that oral health wasn't that great in this country. And 20 years later, well, it actually got delayed because of COVID, the National Institutes of Health issued a report on advances and challenges oral health in America, sort of an update to the Surgeon General's report. And what they found was 40% of people over 65 report a physical or cognitive disability, which affect the capacity to maintain good oral self-care. That's a fair amount of people. And the question is, well, the other issue is that, so people are keeping teeth longer, and we know this. And I can tell you just from experience that in the years I've been practicing, that when I first started out, there wasn't a week going by that I was not working on a complete set of dentures for somebody. And the last couple of years that I was doing geriatrics, maybe I would do 5 sets of complete dentures in the entire year. So people are really keeping their teeth longer, but they're still experiencing preventable decline in oral health. So we have all these advances, but why are people still having dental problems? And one suggestion was that Medicare, which is the primary provider of health insurance for older adults, doesn't cover dental care. And if you had dental insurance, because your employer provided it, once you retire, you lose those benefits now. I think the days are gone where you kept your benefits forever and ever after you retired from a big company. And the concern is that there's a discrepancy between medical care and dental care. You have access to medical care, but dental care is more difficult to get. And it leads to the perception that, well, if it's not part of Medicare, maybe it's not really as important. I understand health insurance is important, but it's not covered. So, maybe it's just optional. And the result is that it seems like oral health care is now an elective part of our health system. And this has a huge impact on the well-being of older adults and just Americans in general, I think, where you don't have access to good dental care. So oral health is important. One is that just good oral health improves well-being and quality of life. And I've been mentioning that because it's true, and I'll continue to mention that. And obviously, people are willing to pay a lot of money to have dental work done to improve their smile because it makes them feel better about themselves. It also improves their social interactions because they don't mind going out with a nice smile. And if you don't have infection in your mouth, then your overall health is better. So there's reduced infection, there's reduced pain. Nutrition is obviously important. The mouth is how we get all of our energy, and our food goes through the mouth. And what we know, and it matters what you eat. So you can't just live on ice cream even if it tastes good. And we know that the status of the dentition is going to impact food selection. So people that have a poor dentition or a compromised dentition are more likely to start choosing softer foods that are easier to eat. And softer foods tend to be higher in carbohydrates and lower in protein. So there's going to be a definite impact on their nutritional intake. Eating is also a social activity. What if you're embarrassed, and especially in long-term care facilities where you come down to the dining room to eat, everybody eats together? Well, what if you're embarrassed by the way your teeth look, or you're embarrassed because it takes you so long to have a meal? You may choose to stay in your room and just bring your food up to your room. And that's going to lead to social isolation. And one of the things we've learned from the pandemic is what social isolation's done to cognitive, the impact on cognition and cognitive impairment. So there've been a lot of studies that have shown an association between periodontal disease and systemic diseases. And I always like to talk about these, but I'm not going to talk about them now. Cardiovascular disease, respiratory disease, diabetes, frailty, depression. But, based on what I've been saying, we hopefully understand that oral health can impact general health, and it can have a positive impact on quality of life. And based on all those studies, we know that infection in the mouth can be associated with disease in other parts of the body, and that includes the brain. I think a really important aspect of all this is that dental disease can be prevented, and we'll talk about that in a few minutes. So let's get to some studies linking periodontal disease and dementia. And there have been a number of studies. I'll review I'll summarize these afterwards, but I want to focus on two that I think are some of my favorite studies now. So this first one, chronic oral application of a periodontal pathogen results in brain inflammation, neurodegeneration, and amyloid beta production in wild-type mice. And this was really interesting because what they did is they took the bacteria Porphyromonas gingivalis, which is a periodontal pathogen. They fed it to mice orally. And what they found is the brains of these mice, they saw Porphyromonas gingivalis in the brains, but I think more interestingly is they saw the changes that we see in Alzheimer's disease. So they saw neurofibrillary tangles and amyloid plaques in the brains of these mice. And they didn't see that in the controls. And then this study was suggesting, so all the studies that I've looked at and all the ones looking at relationship to other diseases are associations. We know that there's an association, and some of them are really strong associations, like with cardiovascular disease. Well, this study suggests that there may actually be a causative relationship with Alzheimer's disease and periodontal disease. And they cite the previous studies that show that in mouse models that you can produce amyloid plaques and neurofibrillary tangles in the brains with this bacteria. We also know that the bacteria shows up in the brain. It can cause inflammation, which can affect memory. And I love the conclusion here. I know we do not want to get Alzheimer's disease and dementia. So here's a nice take home. Their conclusion was maintaining a healthy mouth, managing gum disease with good oral hygiene and routine dental care throughout life is likely to reduce the unnecessary of Alzheimer's disease in some individuals. So if you needed another reason to brush and floss, there's a really good one. So I've been talking about well, let me summarize the studies that I had up there. So chronic periodontal disease increases the risk of getting Alzheimer's disease. Oral infections with Porphyromonas gingivalis in various mouse models has resulted in changes in the brain that are seen in Alzheimer's disease. Porphyromonas and its toxins have been detected in autopsy brains. And oral bacteria can cause inflammation, which can affect memory. Alzheimer's disease, the pathologic condition, may be regulated by controlling the bacteria that's in our mouths. There's a connection between oral health and oral function and deterioration of cognition. There's also an association between tooth loss. People that have lost more teeth and also lost chewing efficiency because of it have an increased risk of getting dementia later on in life. So take home, controlling oral bacteria and improving chewing may decrease dementia, which I think we all want to do. There have also been studies, one of the studies that was cited before, that suggests that there's a link between oral health and the development of Alzheimer's disease, suggesting that the oral cavity could be a good source of important biomarkers for Alzheimer's disease, as well as a modifiable target based on the fact that if we control the bacteria in the mouth, we may potentially control the bacteria that gets into our brains. And just a plug for a study that I'm involved with now is we are actually looking at the oral microbiome and all features of Alzheimer's disease and biomarkers. So if you're interested, you'll have a copy of these. You can contact Dr. Yang. So I've been talking a lot about the fact that there's a relationship between periodontal disease and Alzheimer's disease. Well, it's bidirectional. So people that have dementia, there's also going to be an impact on their oral health. And one is, with dementia, at some point, you're going to forget how to brush your teeth. So we need a caregiver to step in and provide this oral care. That's not always easy. Sometimes the individuals are resistant to care. And so that's a problem. The other thing is people with dementia, sometimes it's difficult to access professional dental care. Finding a provider, transportation may be difficult. There may be financial limitations because, as I mentioned, Medicare is not covering routine dental care. So this falls on care providers a lot of times to prevent problems. So this applies to everybody. Brush your teeth for a minimum of 2 minutes twice a day with a toothpaste containing fluoride. Make sure you clean between your teeth every day. And that could be there's interproximal brushes, there's floss, just something to get in there. If dentures are present, they should be coming out every night. Clean them, and then they soak in water or a denture cleanser overnight. And also, don't use toothpaste on dentures. It tends to be abrasive. It can scratch them. Just mild dishwashing soap works great. And then the third thing with dentures is just because you have dentures, if you have no teeth, doesn't mean you never have to see a dentist. Dentures are plastic. They will stay the same. The mouth is living. It will constantly change. Bone is remodeled. So at some point, and it varies between people, the dentures may not fit, may need to be adjusted, may need to be remade. Limit food that contains sugar, high sugar, which, we sort of know that, and then routine dental care. All right, what about for people with dementia? So what I would say is attempt mouth care every day. And you may not be successful every day, but every day is a new day, so it's worth trying. Check different times of day might be better too. Just because, it's ideal before bed and after breakfast, that may not be the best cooperation time. So anytime during the day, you can get mouth care done. If the individual can do their own mouth care, that's great. Just give them the toothbrush, toothpaste, remind them to brush. And it's important to use a fluoride-containing toothpaste. So fluoride is the single most cost-effective measure to prevent tooth decay. And there are prescription toothpastes that have a much higher concentration of fluoride that I prescribe often for people that are at high risk for dementia. For dental decay. As far as brushing, I like to try and stand, and none of these rules are hard and fast, but I like standing in front of the person so that you're not sort of sneaking up from behind and startling them. They see you coming. Have everything you need ready. Don't force the mouth open. You can actually cause problems. And even if the mouth's closed, if you slide the toothbrush in there, you can still get a lot done. Brushing some teeth is better than others. Oh, and also use a toothbrush. Don't use the sponges on sticks, the toothettes. They just don't do any work. And if you can get that in the mouth, you can get a toothbrush in. I often get, I'm brushing mom's teeth and she's just chewing on the toothbrush. That's good because it forces the bristles. You will still disrupt the plaque. So there's nothing wrong with that other than you're going to replace a lot of toothbrushes. And stay calm. And just expect to spend a little more time and you will get things done. All right, other things to be concerned about. Dry mouth is one of the biggest problems I see, and that's going to lead to problems with cavities. There's also risk for infections, fungal infections, difficulty with speech, eating. It impacts denture wear. The big issue, it's usually uncomfortable. And the other point I like to make, it's usually a medication side effect. It is not because you're getting older. Dry mouth is not a result of aging. The best thing is to sip on water, and there are saliva substitutes, lubricants. The important thing is if you're doing something for dry mouth, it should be sugar-free. Sweetened xylitol is better. And then if you want a mouthwash, alcohol-free and lots of fluoride. Dry mouth really increases the risk of getting decay. Other things to be concerned about in general, just if there are sores that do not heal. So my new life now is I'm doing dental oncology at the cancer center here. If there's a sore, see what the problem was. If there was a rough tooth and you smooth the tooth off, things should get better. If they don't get better, then it needs further workup. That goes for swellings, red areas, all of this. Should see a dentist. So here's just a general question that I'll give you a minute to think about. You're caring for an individual with late-stage dementia, and that person has become agitated. They've stopped eating, and now they're losing weight. The individual has a maxillary complete denture so that's on the top, and they've got some natural teeth in the bottom. What do you want to do? And I sort of broke this down to two things. One is, should we be concerned enough where we want a medical workup to see, hey, maybe something else is going on, and do a lot of imaging? And the other choice, and you can see where I'm going because the disclaimer here is I'm a dentist. So the other choice is, do we want to look in the mouth? And yeah, that's what we want to do. The mouth is a wonderful place for hiding infections, for being sources of pain. And this was a case, and this was taken from a real patient, several patients that I've seen in the past. It was a person that had a complete denture. And you can see when the denture is removed, there's that ulceration up in the buccal vestibule. That hurts. That's why you don't eat, and if you're cognitively impaired, you can't say it hurts. So what happens is you can become agitated because it hurts. You can stop eating because it's a reflex. It hurts to eat. You start losing weight. And especially with individuals with dementia, a lot of times the diagnosis becomes, well, dementia is a progressive disease, and unfortunately, we're going to a later stage in the disease. And that may not be true at all. Maybe that there's something simple, that there's a source of pain somewhere, which is causing the agitation. And if they're not eating, the mouth is a wonderful place to look. And these are really simple to treat. You adjust the denture, everything goes back to baseline.
Hey, Dr. Hendler, Dr. Barilotti had a question for you about dentures. It might be a good time to answer this question as well.
Sure.
And her question was, is there a timeline for use of a particular set of dentures if they continue to fit?
Now, as long as the dentures are functioning, there's no reason. I've got patients that haven't been for decades. The other thing that I will tell you too is that it's really difficult sometimes to make new dentures for somebody with late stage dementia. One from a standpoint of actually fabricating it, but the other is that, when you make a new denture, you're going to correct all the problems that the old denture had. And to the person, that's not their denture. It doesn't feel the same and they're not going to want to wear it. So unless there's something really bad, I will leave old dentures as long as they're reasonable, even if the teeth are worn down. And, you can do a lot to repair them too. Okay.
Very helpful.
And as far, so dentures can last as long as they can last sometimes. Some tooth trivia. I like to say this in every presentation I give. The mouth is part of the body. So things that impact the mouth will impact the body. You don't lose teeth because you get older. You don't have gingival recession because you get older. But teeth do darken as we get older, and that's why bleaching is so popular. Teeth do become less sensitive with age, which is nice because you can have a lot of restorative done without any local anesthetic and you don't feel it. People without teeth still need oral examinations, and fluoride is not just for kids. So what should I remember? Well, the mouth is part of the body. So disease in the mouth can influence disease in other parts of the body and impact general health and overall well-being of an individual. And preventing dental disease can help maintain general health and positively influence quality of life. Healthy smile is ageless. And I'll leave everybody with this. I wanted to leave plenty of time for questions. I know I went through things fast, but happy to answer questions. But I just like, I've been putting this at the end of a lot of presentations. We don't stop playing because we grow old. We grow old because we stop playing. So I encourage everybody to continue playing forever. Thank you. I'm happy to take any questions now. If you want me to go into more depth on anything else, I'm happy to do that. And here's
Hey, Dr. Hendler, thanks so much. Leave that response up so that folks can have a chance to QR code scan and offer you some feedback. There are 2 questions in the chat, and
Sure.
I'll let you see those if you can. But for those who are on their phones in their cars and shouldn't be looking at the screen, the first question is from Dr. Birju Patel. You spoke about the oral microbiome. Can you speak to the importance of the oral microbiome and the effects of oral mouthwashes such as Listerine and altering this and problems that might be caused by it?
This is like, I'll let you know when I finish with these studies on looking at the oral microbiome and Alzheimer's.
Perfect.
But it is important. Mouths are not sterile, so you don't really want to kill everything in your mouth. You need some of the bugs. Digestion starts in the mouth, so you actually need some stuff in there. I'm not a big, mouthwashes are fine as an adjunct. I'm not aware of studies where it gets altered. I don't know whether they're targeted for specific bugs, but mouthwashes are okay. You can use them. And I'm not aware that it creates a big problem. I know you don't want to sterilize your mouth. So I hope that answers it, but there's a lot more to come on the oral microbiome and the gut biome and relating to general health.
Hey, thanks for that answer. And I know that you're also someone who is not very interested in mouthwashes that dry the mouth. You had talked about that earlier.
That is right. That is really true too. And that becomes a big issue, especially stuff like Listerine is really high in alcohol. So you do want to be careful. If you want a mouthwash, choose one that doesn't have alcohol, like I mentioned on one of the previous slides.
Hey, Rosie Rogers has this question. Is bleaching your teeth okay? What are your thoughts?
Yeah, if you don't like the appearance of your teeth, and you want them lighter, you can bleach them. And there's a bunch of ways to bleach teeth. The simplest is, I have no financial interest again, but you can go to the drugstore and just get one of those white strip things to bleach. There have been studies, or your dentist can make you trays and you can bleach at home. But there's enough studies on that it's safe. There are a couple of people that may develop sensitivity to the bleaching products, and then you can just sort of stop doing it or put fluoride in the trays on alternate days. The other interesting thing, there's studies that found is that the gums, the gingiva too. You see really nice gingival margins on people that bleach because the bleach tends to, keep everything clean around there too.
Dr. Anmark asked, does dry mouth lead to gum recession, or is dry mouth just more of a risk for cavities?
Your dry mouth is a huge risk for cavities. Gum recession, usually you see that because there was previous periodontal disease where they were treated, and then because the gums were so inflamed and they lost some bone, once it's treated and you get rid of the inflammation, they shrink down. The other is that people that aggressively clean their teeth. So a hygienist likes to say people like to brush hard and fast, and you can actually cause your gums to recede. You can actually cause notches in your teeth if you're scrubbing your teeth, especially with a hard toothbrush.
Kevin, thanks so much. I'm going to keep you on just for a couple of minutes. I'd ask folks who have the ability to type something into the chat to go ahead and type in something that you learned today and then just hit return. And so while we're waiting for folks to do that, the thing that I learned today that I hadn't ever heard, despite the fact that we've hung out together before, was this notion of using dishwashing detergent on dentures rather than toothpaste. So that was something for me. So looking for folks who learned something today that want to put that in the chat. just to share with others and to consolidate your learning by go ahead and typing it out. Just wanted to check and see if anybody wanted to come off mute and ask any questions. Hey, there we go. Same here, dishwashing liquid on dentures, bleaching is safe. Hey, thanks, Hope. Dr. Bakari, bleaching is safe. Great. Kevin, you get to see a lot of folks, and certainly in your past practice in terms of being a special care dentist. And so talk to us a little bit about what's different about working as a special care dentist, particularly in patients with Alzheimer's disease versus your general dentistry practice.
So I think the big issue is that when you're dealing, I mean, the dentistry, sometimes it's modified because, you know, you can't always do, quote, ideal dentistry on people because there's cooperation issues. But I think the take home is that really any dentist should be able to provide basic care to somebody with dementia, somebody with special needs. And one of the organizations I'm a part of, we really stress this, but, you know, it gets to be intimidating. The big secret is you just have to be willing to spend a little more time and you can get stuff done. I worked with excuse me, people with late stage dementia for a lot of years. And occasionally I would use something like Ativan prior to the appointment, but I got a lot done just by spending time being calm with the person. And that was very rewarding to me because I would get referrals from private dentists that, you know, we can't get anything done. And we would see them. And with our staff, we would get x-rays done. We would get cleanings. We would get fillings done. So I think the take home is any dentist should be able to do it. They just have to be willing to take a little bit of extra time. And it's a huge benefit because a lot of these patients have difficulty finding care, as I mentioned before.
Great. Hey, thanks so much. Really appreciate the time that you spent with us today. I just wanted to give anyone else one more chance to offer any comments, testimonials. I know that you've got some practice partners on this call who have sent you patients before. And so,
yeah, I saw this one thing, Listerine is bad. I wouldn't go that far. I don't want to say it's good in certain occasions, but it tends to be really potent. So I don't think it's good, you know, it's not right for everybody, or dilute it with water. But there are good, Listerine does have some good studies behind it. It will kill plaque bacteria. So,
hey, great.
yeah.
All right. Hey, thanks so much. Really appreciate everybody joining us today. Make sure that you have a chance to put in your comments about today's session. Dr. Hendler, thanks again. It was a pleasure to see you and really appreciate you coming and joining us today. Hey, thanks, everybody. Let's have a great day.
Having me.
All right. Bye-bye.
Bye.